Hello and welcome. Today we are going to speak about uterine fibroids. It is a condition that unfortunately most women are going through today. Essentially, we will be speaking about what are the causes of uterine fibroids, what are the symptoms of uterine fibroids, how to track through certain tests, what are the herbal medications, detox drinks, diet therapies, natural therapies that can help towards the fibroids. We will also be discussing about certain yoga asanas and certain energy medications that are unheard of with respect to uterine fibroids. Now, the uterine fibroids are essentially certain fibrous tissues that are formed into the uterine walls of a woman. Now, this is typically in the childbearing years of the woman. They are non-cancerous in nature, and technical term used for uterine fibroids is leiomyomas. There are essentially 4 types of uterine fibroids. They could be subserral fibroids, which are in the outer layer of the uterus. There are submucosal fibroids, which is in the inner layer of the uterus. There is intramural fibroids, which are on the myometrium of the uterus. And fourth, there is pedunculated fibroids, which are essentially hanging from the uterus. They could be in the subserral regions or submucosal regions. Usually, these fibroids are divided into 3 different sizes. It could be anywhere from a pea size to a size of a melon. So, a small size could be anywhere between 1 to 5 centimeters. A medium size could be anywhere from 5 to 10 centimeters, and a large size fibroid can be anywhere from 10 centimeters or even more. What are certain tests that a woman can go through to figure out if she has fibroids, or if they are, what is the size of it? Typically, it is done with ultrasound with sound waves, or it could be done by a saline infused injection that is given into the uterus to create certain images. It could even be a CT scan, a CAT scan. It could even be an X-ray or an MRI or a blood test, which is called CA-125. It assesses the amount of protein into the bloodstream of the woman, which gives an indication of certain diseases like endometriosis. It could be ovarian cancers, or it could even be fibroids. However, amongst all these tests, the most common and considered as most reliable is the ultrasound with sound waves. So what are certain causes for uterine fibroids? Number 1, it could be your insulin resistance or leptin resistance. So if the woman is craving for a lot of carbohydrates, or she has weight gain, or she has anorexia, or she is facing some hormonal imbalances, significant disruption into her circadian rhythms, unable to sleep in time, or if she has chronic inflammation, this could be a contributing factor to leptin resistance or insulin resistance, leading to uterine fibroids. Uterine fibroids are very common because of estrogen dominance, and this essentially comes from the xenoestrogens that are because of the chemical exposure that a woman goes through. It could be anything from the lipsticks that she applies on herself, or it could be the shampoos that contain parabens. It could be the toothpastes that she uses, or the fragrances and perfumes or deodorants that she uses. They can be very toxic. Even the sunscreens that are available in the market, it becomes very essential to go through the labels in case they contain something called as benzophene, or it contains 4-MBC. You may want to check on usage of those sunscreens. It can be very toxic to the hormonal imbalances of a woman. A lot of times there are these red food colorings which is very easily available in the market today. When you go to restaurants, you see a nice red color in some of your sabzis and vegetables and curries, and that is owing to the red food coloring or the red dye that is available onto it. It is also available in certain red drinks, and we may want to refrain from using that because it can be a huge contributory factor to the hormonal imbalances and overall health of a woman. Obesity is also considered as a contributory factor because a lot of women who undergo fibroids are known to have a lot of belly fat. Now this obesity can also be because of the insulin resistance or the leptin resistance that she's undergoing, and hence that needs to be fixed first. It is very important for a woman to stay in a healthy weight. Fibroids can also be caused because of vitamin D deficiency. So if somebody is deficient in vitamin D, it is this vitamin D that stops the growth of the uterine fibroids, which is very essential. Unhealthy diet, which is through your unhealthy fats, essentially through the fats that are available in the market. It could be the PUFAs, which is polyunsaturated fatty acids, that can be a contributing factor, increasing your free radicals and lot of inflammation into your body. It could be consumption of dairy products. Now there's a lot of research that says that dairy products may be a contributing factor because a lot of cows today are hormone injected. Along with that, cows are also not grass fed, and they're usually fed with grains that may contain mold, leading to certain disruptions in the human body consuming that milk. Fibroids may even be caused because of EMFs, that is your electromagnetic frequencies. So try and switch off your Wi-Fi routers in the night. Try and be as far as possible from the digital screens, at least 1 to 1.5 hours before you sleep. It is necessary not to have overexposure to EMFs. Now, melatonin is known to shut the fibroid tumor growth, and it is said to shut the ELT3 tumor growth, which is a huge contributing factor, and hence it becomes essential for a woman to make sure that her sleep patterns are right, her circadian rhythms are right. What are certain symptoms of uterine fibroids? Now, she may go through irregular menstruation, she may go through heavy bleeding, she may go through painful menses, she may have cramping, she may have infertility, headaches, hormonal imbalances, lower back pain, painful intercourse. It could be irritability and moodiness, it could be an increase in weight, it could even be hot flashes, pelvic pain and constipation. More importantly, it can also lead to pain in certain organs around the area where the fibroid is located. So if the fibroid is located in an area that puts pressure into the urinary bladder, there could be a case of frequent urination or a whole lot of other issues that are around the area where the fibroid tumor is located. It is important that a woman having uterine fibroids increases on her magnesium. So magnesium will come from pumpkin seeds, or it could even be in magnesium oil spray. Now this woman also may want to increase her zinc, because now this zinc helps in increasing the progesterone production, and there is always this balance required between estrogen and progesterone, and increase in progesterone will balance out the estrogen dominance. She's supposed to have some healthy probiotics, which means she may want to have certain sauerkraut or kimchi or pickles made in Indian traditional style, and peanut yogurt or coconut yogurt, plant-based yogurts, which will help in giving the right probiotics necessary to heal these fibroids. What is the diet that a woman with fibroids is supposed to go through? Now, if a woman is suffering with uterine fibroids, she may want to focus on cruciferous vegetables. Now, these cruciferous vegetables may have indole-3 carbinol foods. So when these indole-3 carbinol foods specifically comes from cruciferous vegetables, it could be cabbages, or it could be cauliflowers, or it could be broccoli, or it could be Brussels sprouts, spinach, or even radish. Other foods that can help her can be carrots, almonds, pumpkin and pumpkin seeds, omega-3 fatty acids, which will come from your flax seeds, walnuts, etc. Fibrous fruits like oranges, like apples, like bananas, pomegranates, etc. Onions and garlic, beetroot for sure, legumes, which is beans and chickpeas, or peas and lentils, and a lot of vitamin E and B rich foods. What are certain detox drinks that a woman undergoing uterine fibroids may want to have? She may want to have green tea. Now this green tea has certain bioflavonoids, and it also has certain polyphenols which are known to decrease the estrogen. She may want to have barley water, tulsi water, dhania water, which is your coriander seeds water, beetroot juice, turmeric water, pomegranate juice, orange juice, apple juice, coconut milk, green juices with the fiber, and a lot of warm water throughout the day. Certain herbal medicines that are known to help the condition of leiomyomas or uterine fibroids are turmeric, which is haldi, sambhalu, which is also called the chaste tree berry. It is used in a lot of Ayurvedic Ayurvedic and Unani medicines. Jamun, it is your black maca or blueberries. Kanchanar gugulu, which is also the black cohosh. It is a phytoestrogen and it essentially blocks the xenoestrogens from entering the cell receptors. It could be green tea or prabhal panchamrit. From an energy perspective, what is required for a woman undergoing uterine fibroids is peace meditation. Now this, along with peace meditation, she may also want to focus on her second chakra, because that's the area where the fibroids are located. Now this second chakra essentially refers or relates to the reproduction. It relates to a lot of energy balance into the body. And any problem with the second chakra also refers to either having certain relationship issues or money issues in the past. There are certain stones that are specifically catering to the second chakra, and these stones are called orange jasper, orange carnelian, fire opal, tiger eye and amber. These stones particularly are orange in color and they focus on the second chakra, because orange is the color of the second chakra and it is very helpful in releasing the old stuck energies in the human body. Now there are certain yoga asanas that can tremendously help women undergoing uterine fibroids. Number 1, it could be Bhujangasana, Kapalbhati for 20 minutes, Supta Virasana, Supta Baddha Konasana, Surya Namaskar, Shalamb Setubandh Sarvangasana, Brahmari and Yoga Nidra techniques. One mudra that is particularly focused around the hormonal balancing and may particularly lead to the second chakra or the fibroids is the Yoni mudra, and it is essentially this mudra. So when you do this mudra, it particularly focuses around your hormonal balances and hence is very apt for a woman undergoing uterine fibroids. Now coming to naturopathy treatments that are used for fibroids. Now a lot of women essentially have said that they have been able to treat their fibroids naturally, or they have been able to shrink the size of their fibroids naturally by applying a castor oil pack. So when you apply a lot of castor oil on your abdomen, cover it with some insulation and hot pack over the abdomen, castor oil penetrates far deeper and it is known to break any lumps and bumps and cysts, etc. It has the capability of breaking the fibroids, and a lot of women have been able to support this fact. Cold therapies like your ice dunks or ice bathing, cold showers may also be very helpful. Intermittent fasting will provide the body enough time for detoxification and is essential for a woman undergoing this condition. A hip bath, which is soaking into the water wherein your entire hip region is covered along with certain area of your abdomen is covered, for 20 minutes daily may be very helpful. Alternate hot and cold packs on your abdomen. It could be pranayam and it could be sunbathing for vitamin D. It could be full body massage for 45 minutes at least once a week. It could be mud packs or direct mud applications on your stomach. Now this medicated mud that is available in the naturopathy hospitals usually has the capability to cool down and increase stimulation, increase circulation and help towards curtailing the growth of these fibroids. A hot water immersion may help, and a steam bath for 5 minutes at least twice a week. Let's understand certain acupressure points and reflexology points that will be very helpful in this condition. So in the soles of your feet, you have a bladder point and you have a kidney point. Now these 2 points, if stimulated 20 times each, be helpful in this condition. Between these 2 areas, that is the kidney point and the bladder point, there is a pathway which is the ureter, representing the ureter. So a gentle massage into that area as well 20 times will be very helpful. From an acupressure point of view, there is a point on your stomach which is called the stomach 30, and that will also be very helpful in this condition. How do we track if our fibroids are really getting cured or not? So if a woman has some fever after undergoing all of these treatments, then it may be a sign that the body is trying to fight it out and hence the fever. It could be a very positive sign. If a woman has certain vaginal discharge that is pinkish in color or watery, that may be an indication of the shrinking of fibroids or breaking it up, and that may be a positive sign as well. A sharp abdominal pain, particularly in the cockle region, may also indicate that it is a positive sign. A dull achy pelvic pain or increase in your WBC count may indicate the same. And of course, you have your ultrasound reports to clearly specify this. So today we discussed about certain yoga therapies, we discussed about detox drinks and diets. We also spoke about certain acupressure points and reflexology points. We spoke about the causes and symptoms and the ways to track how the fibroids are healing, and also to figure out how do we understand that the fibroids are present. So this was the crux of the entire session today. I hope this was helpful. If you are liking the content, please like, share, subscribe, comment and share your experiences. I would love to hear from you. Thank you so much for listening. See you again in another video. Till then, namaste.